One early morning in my clinic, a visibly anxious patient walked in. She has just been informed that she had an ovarian cyst discovered during very first pregnancy. Naturally, she was very overwhelmed with worry. Upon examining her, I noticed suspicious features in the cyst. But how do you tell a pregnant woman she might need surgery? A decision that could risk her pregnancy. I advised an MRI, and soon after, the head of radiology called me with the results. The cyst appeared malignant or cancerous, and the immediate surgery was the only option. It was a delicate balance. Operating during pregnancy always carries a risk. Surgery was performed, and histopathology report confirmed borderline ovarian cancer. Thankfully, we caught it in the time. The pregnancy continued smoothly, and today the couple is shining the example of resilience and hope, and the testament to the miracles of modern medicines. Stories like this, though complex, are not common in our field and remind us why we do what we do. And here, I must acknowledge the pivotal role of Dr. Rady Warda, our head of radiology. Hi, Dr. Rady.
Hi.
How are you?
I'm fine.
Yeah, I will introduce Dr. Rady is our head of radiology, and he has more than 3 decades experience in radiology. And when we get that call that this is it and what action needed, so the wizard who is behind the curtains is Dr. Rady.
Yeah.
So, since we decided that we'll be doing some session on MRI, and MRI is really a pivotal role in the diagnosis and management. So, Dr. Rady, what do you say about MRI?
Actually, MRI now is the imaging of choice of many diseases of the body.
Right.
First, we want to know what is MRI.
Yeah.
MRI is use of the magnetic field
Yeah.
in generating images of the body.
Right.
How we can make this? We are using a big magnet which in the machine, and the body is put inside this magnet. As we all know that our body, it is consists of millions of magnetic interactions.
Right.
But when we put this body inside the main magnet, it will react. The protons will be aligned in rows. So we have to excite these protons through pulses of radio waves. This excitation trying the proton to return back to normal alignment, generating energy of different intensities. This energy converted into signal through a computer system, and at the end, the image of the body is generated. So we are using the magnet interacting with the body magnetic fields to generate the images. No ionizing radiation at all.
Right, that's amazing, because a lot of people think that MRI is so diagnostic, so detailed. So is it too much radiation? So very well said that it is not ionizing radiation, but it's a magnetic and radio waves, which are not harmful in the daily life.
At all.
So when we were talking, since I told this case special, the pregnancy with the cancer, and then why we reached to this point, as we were having discussion yesterday, and you said it's a gold standard. So let's talk about the gold standard.
Actually, when we are comparing MRI with the other imaging modalities in women, first we are talking about ultrasound. Ultrasound also is safe, but when comparing MRI with ultrasound, MRI has superb soft tissue contrast resolution,
Right.
can discriminate the minor changes in the pelvic organs,
Yeah.
can detect early cancer, can differentiate between cancer and non-cancerous lesions. Even it is now the golden standard for staging of cancer in general, especially in pelvis. MRI also have a very important role in congenital anomalies of the uterus, which is difficult to be visualized by ultrasound.
Exactly.
Even if we use hysterosalpingogram, it is a little more or less invasive, inject contrast inside, very painful for the patient.
Yeah.
But the MRI of the pelvis can detect easily any congenital anomaly. Patient lying in the machine, in the table, inside the machine for a half an hour.
Yeah.
And at the end, we confirm what type of congenital anomalies. It is one congenital or complex anomalies. So MRI, what is important, what is specific for MRI is high soft tissue contrast resolution. It is the image modality of choice for imaging all soft tissue organs in the body. That's why we are using it routinely. When ultrasound findings are in equivocal, we are using routinely in the pelvis. Also, it is the first imaging modality for the brain and the neuroimaging, brain, spine. Even in the liver, ultrasound is commonly used for abdominal examination for the liver. Now, MRI is more specific than ultrasound in characterization of tumors of the liver, in grading of tumor of the liver, in biliary system. Even there was a wrong misunderstanding that MRI is not good for bones. No, it is now bone marrow imaging. It is specific for MRI only. The changes in the bone marrow, it is very specific to MRI. Anemia, multiple myeloma, very many diseases of the bone marrow can be detected only by MRI.
So rather bone per se, it's inside the bone soft tissue.
Yeah, that's the bone marrow itself.
Yeah.
Not for the cortex, for
Not
the bone
for the
marrow
cortex.
itself.
Amazing.
There was wrong belief that CT is more accurate than MRI in bone. No. CT, yes, okay, the cortex. But what is inside the cortex? Bone marrow, which is very important.
Yeah.
No imaging modality can detect diseases of the bone marrow, only MRI.
MRI. And also it is
Sports
good for
injury, of course.
sports injuries. Even though people think that
sports
it could
injury,
be bone, but it's
no way. Sports injury is number one indication for MRI.
MRI. Especially muscle and the joint tissue. They're more of
ligaments, meniscus. Now it is also actually MRI now. The image modality of choice for all disease, but we are not start with MRI in most of cases.
Yeah.
MRI is expensive and little bit time consuming.
Yeah.
And many diseases can be diagnosed by other modalities, but we go to MRI when problem solving and in specific diseases, we can use MRI.
MRI, yeah. It is really super detailed and it's super flexible that it can reach to the places. Like, it's not like a X-ray that you just stand, or ultrasound where sometimes your abdominal wall, if it's thick, it's less accessible. So it is super flexible to have the accessibility even deeper inside the any part of the body.
Let me say that MRI now is used for lip and tongue lesions.
Right.
Nose. Any organ in the body, I can image with MRI safely.
And even
the finger, the nail.
Yeah. Wow.
Everything. We can use special coil. In MRI, it is not magnet and the table. There is what's called coils. Coils, it is something placed over the area interested to be examined. This is called coil. Coil, it accumulates the signal and send it to the machine.
Right.
We have different coils of the MRI of different size for every part of the body. For the heart, for the finger,
Amazing.
for the TMG,
Yeah.
for the lip, for the tongue, for the eye, of course.
Wow. So it's not the same traditional machine. It's very advanced
Yes.
these days.
MRI pass through different stages according to get to affect the image quality. The strength of the magnet will reflect the quality of the image. If
Right.
the magnet of low intensity, the image quality will not be so good.
So good, yeah.
So we start with less than 1 Tesla MRI,
Yeah.
and then 1.5 Tesla, and then 3 Tesla now. 3
Wow.
Tesla is the commonly used in the market, which has the best image quality.
Right.
We have in our hospital
Amazing.
3 Tesla, and also we have 1.5 Tesla.
Wow.
3 Tesla is, if you compare the image of 3 Tesla with 1.5 Tesla, totally different. The details of the articular cartilage,
Right.
any erosions, any ulcers can be seen by 3 Tesla MRI. Differentiation between minute hemorrhage in the follicle or fat can be discriminated easily by MRI. Because we are using in MRI what's called different sequences for different tissues in the blood. We have sequence for blood, we have sequences for fat, we have sequence for fluid, we have sequence for soft tissue. When we are using this sequence, it tells us what is the nature of the material inside this part of the body.
Amazing.
And at the end of the day, we can reach to a professional diagnosis and final diagnosis. Also, I want to highlight that because sometimes patients are afraid from the word contrast media.
Contrast
Yes.
medium, yeah.
Contrast media, of course, has benefits in many cases because it gives us it gives us the pattern of enhancement of this lesion, and so we can more characterize this lesion.
More characterized.
Contrast media MRI is totally different from contrast media used in CT or in CT.
Right.
It is not iodinized contrast media. So it is
Friendly.
safe
Yeah.
contrast. Even can be used with renal impairment.
Wow. Is this the reason you guys don't do creatinine these days?
No, yeah, it is not. Yeah, it can
Because
be,
in the traditionally we used to do creatinine.
Only, يعني we can even patient with chronic renal failure can we use MRI, but with cautions.
With caution.
But it is not harmful like
Yeah.
CT contrast media.
So this is the reason we are not doing creatinine these days.
Yes.
In MRI.
Yes,
Traditionally
not
we used to
routine,
check the kidney
yes.
before.
We are doing only if the patient will know that it has chronic renal failure on dialysis, and we can do also MRI.
Right.
There is important sector in MRI also called functional MRI.
Right.
You know that all imaging modality, when we are imaging a part of the body, it gives us anatomical details of this part.
Right.
And any changes in this part, we can analyze the findings and put a provisional diagnosis. Sector MRI called functional MRI. What is functional MRI? Is not only anatomical, not only image the uterus and seeing mass which could be uterine fibroids, uterine sarcoma, or whatever. Or functional MRI, we can see the behavior of this lesion through some sequences, using also contrast. The dynamic contrast is part of functional MRI. Dynamic, what does it mean dynamic? I inject the contrast and I take serial images.
In the real time.
Real time.
When it's penetrating.
Penetrating, yes. So malignant or cancer, the behavior of cancer for uptake the contrast totally different from non-cancerous lesions.
Wow.
Okay, and I can trace what's called dynamic curves.
Yeah.
Dynamic curves Usually the cancer, sharp rise and sharp down.
Yeah, because active cells.
Yes, but the non-cancerous slowly
Stable.
plateau.
Stable tissue.
So
stable
this is
things.
one of the functional tools of functional MRI. Also,
Right.
we are using what's called diffusion imaging.
Right.
What is diffusion imaging? It is not imaging, routine imaging of the part of the body. It is imaging of the motion of the water molecules.
Okay.
Motion of the water molecules, it is guided by different factors. If there is cytotoxic edema, if there is much cells inside the extracellular spaces. So I image the moving water molecules. If there is restriction or no. Restriction means pathology. I analyze this restriction if it is malignant or benign or strokes. However, so diffusion with images is part of the functional MRI. We also image the metabolite of the part of the body, what's called the MR spectroscopy.
Right.
We are imaging the metabolite release of the part of the body. Normally, the brain, there is some metabolite excreted from the body. I can trace it. If it is benign tumor, there is some release. The metabolite it changes. So imaging of the metabolite of the body, it's called the MR spectroscopy. It is one of the functional MRI.
Amazing.
Yes.
So now I want to tell patients that when they simply get that there is a benign and malignant, there's so much sci-fi is behind, so much, whatever the Dr. Rady recent few minutes said, it looks really, really advanced. So when you get the report, there's much more happening behind it.
Yeah.
So I will tell you that when you said the giant magnet, I used to work in a hospital, and what happened that there has to be an MRI-friendly stretcher. Patient was brought in a normal stretcher, and this giant magnet pulled this stretcher, and luckily patient was in a position that it didn't got pulled with the machine. And then they have to do the reconfiguration of the machine because even the machine malfunctioned with this stretcher hitting suddenly. So, it's really a giant magnet, but does this magnet pulls the metals out of the body of the patients, because that's a myth also.
Actually, this was happening in the past, in the beginning of use MRI.
Right.
Right now, in all hospitals with MRI facility, there is what's called MRI compatible stretcher.
Exactly.
Wheelchair. Even anesthesia, we can do now what's called MRI with anesthesia. Anesthesia machine compatible with MRI.
Compatible with, yeah.
Okay, so this is never happened nowadays.
Yeah.
All stretcher, all chair, all MRI compatible,
Yeah.
safe to be used by.
Yeah. But probably it was Porter's mistake, and they kept on taking the wrong stretcher into the MRI room.
There is a strong instructions and restriction. There is area of restriction, not allowed to pass it except the technician and the people working in the MRI area. So
That's
we
good
have
control.
a precaution for this.
Actually, this incident was told by quality department.
Yeah.
So definitely there was a slack.
Yeah.
So that is the reason quality department was shaken by that event or incident.
Yeah.
So we were talking about that not just we can define cancerous and non-cancerous, we can do the staging also.
Of course.
Like lesion, you define that, okay, this is this and that. But beside that, we can also say within the benign lesion or non-cancerous lesion or within the cancerous lesion, there's a lot happening. So there's a lot of detail we can see through the MRI. Patients would want to ask that when doctor decides that patient has, everybody doesn't go for MRI, but what are the points when doctor decides that, yes, this patient needs MRI?
Let us talk about the pelvis, okay?
Right.
As I mentioned, ultrasound is now the routine imaging for female pelvis. whatever obstetric or gynecological cases.
Yeah.
Of course, CT, we avoid CT little because of radiation.
Yeah.
CT may be needed further. If we need it, I will talk later. In any case, we found that ultrasound findings is not definite, inconclusive.
Yeah.
I recommend always for MRI.
MRI.
Even if I don't feel that this lesion is malignant or cancer. For example, routinely we are found by ultrasound fibroids, uterine fibroids.
Yeah.
But the surgeon want to know how many fibroids,
Right.
what is the exact location of fibroids, and what is the now there is classification of fibroids
Yeah.
according to the location.
Yeah.
And what is the internal behavior of these fibroids. We are sure by ultrasound it's fibroids.
Right.
But the surgeon, this is not enough for him. If there is planning for surgery, it will be laparoscopic or open surgery. And what is the need of the patients? If there is hemorrhage inside this fibroid or not, if there is degeneration or not, if this is fibroid hypervascular or not. All this information, although it is benign, cannot be attained by ultrasound.
Yeah.
This is
even the classification from inner to outer.
Yeah, it is the figure 1 or figure 2 or figure 0 or figure 7.
Yeah, exactly.
MRI simply has a characteristic appearance of fibroids. Why? Fibroids, it is a compact fibrous tissue.
Yeah.
MRI is what I can say specific for detection of some diseases which have specific tissue predominant.
Yeah.
For example, fatty lesion, MRI specific 100%. No need for histopathology.
Right.
Blood, MRI is very specific. And even the phases, when there is hemorrhage in everywhere in the body, there is stages of hemorrhage. There is hyperacute hemorrhage, acute, early chronic, late chronic, and then chronic and subacute.
By their age.
The ages of the bleeding can be depicted easily by MRI because MRI image the hemosiderin, the extracellular or intracellular hemoglobin can images specifically.
They could be different.
Yeah. Back to the fibroids. MRI easily detect the fibroid because it appear dark or black in what's called T2. It image خلاص fibroid, definite.
And also fibroid to be differentiated with adenomyoma.
Of course. What is inside the fibroids? Very easy to be detected. Hypervascular, hemorrhage, necrosis, cystic degeneration. Dilemma by ultrasound also how to differentiate, as you said, between fibroids and the focal adenomyosis. It is a dilemma. And the management is totally different.
Exactly.
MRI can answer this question.
Amazing.
Easily. If we are talking about adenomyosis, we can talk also about what's called the pelvic endometriosis. MRI now is the imaging, imaging modality of choice for a classification, enzyme classification of pelvic endometriosis easily.
Yeah.
A lot of
especially our hospital being endometriosis center, you're the one we depend on the reporting. So that's also amazing.
As I said before, congenital anomaly, staging of malignancy. The surgeon wanted to, as a characteristic of ovarian cyst, for cancer, the surgeon know if there is surgical or non-surgical.
Yeah.
Staging is very important also.
Now let's move to the planning MRI. So doctor planned MRI on your suggestion, on their own decision. Then pre-authorization is, of course, insurance do not allow MRI without pre-authorization approval. So once we get the approval by insurance provider, we arrange appointment. Normally, ultrasound department, radiology, call the patient themselves for MRI appointment. And then traditionally in the past, we used to do the creatinine, but we are not doing creatinine anymore. Probably specific cases, if there's some renal impairment, maybe we will repeat the creatinine. Then what happens on the day of MRI? We were discussing the other day, and you were telling they have to be not eating for 4 hours. Yeah? Let's talk about the day.
Actually, just eating, only drinking water, coffee is okay.
And even nil per oral, not for all patients.
Not
It's
for
only
all patients. For all patients. Usually, I need this for abdomen
Yes,
and
pelvis.
pelvis. For what?
Yeah.
For trying to eliminate the bowel motion
Yes,
and trying to get the best images. It's
exactly.
only for this. Even we confirm this by giving the patient intramuscular
Buscopan.
muscular.
Yeah.
All of this to trying to get the best images for the patient, because patient moving bowel motion may affect the image. Also, we advise the patient when coming for pelvic ultrasound not to come with full bladder.
Exactly.
Why? Because if you come full bladder, during her stay in the machine for half an hour or more, maybe
Yeah.
wanted to.
She might want to
So
go.
the best. Also, we don't want to be completely evacuated his blood. Just
Yeah.
partially full blood.
Partially.
This
Yeah.
is my advice also.
Yeah.
Just fasting from food only 4 hours.
Right.
Drinking normal water
Right.
fluid. That's it only.
Bladder normal. And they should arrive 15 minutes before,
Of
at
course,
least.
of course.
What happens when patient tells you about metals inside them, like somebody with the pacemaker or some metal plate?
We are asking the patient to come 15 minutes earlier for this.
Right.
We have checklist
Yeah.
for history, for previous disease, for metal implants, for cardiac pacemakers. All this checklist, we should, the technician and the nurse should request the patient to read this checklist carefully and to sign for the positive or negative. This is routine and very important for the patient safety.
Right.
Regarding cardiac pacemaker, for example, now most of cardiac pacemakers are also MRI compatible.
Compatible, yeah.
Even the what's called ear
Implants.
also MRI compatible.
Right.
So no issues now regarding the.
But people who had the
This is
in the old times.
This is all
Not the
wrong beliefs that MRI with metal is not.
No.
Even we can do MRI for the knee,
Yeah.
and the other knee there is metal. No issue.
Okay. Right.
Since is this metal fixed?
So even old traditional metal plates, they're perfectly fine with the MRI.
Yeah.
They're compatible. I will tell you something. When my son had a MRI maybe 10 years back, they asked me that, do you have metal plate? So you cannot stay inside the MRI machine along with my son. And he was only probably 8 years. And I wanted to be with him. And then I needed an MRI for myself. And then it was maybe 4 years back. And I asked them that I do have metal plate and it's not compatible, as my orthopedic surgeon said. And they said, just go inside. And I just had MRI and it was perfectly normal.
Nothing.
So probably it was
Nothing.
also the old concept.
Yeah.
And we already talked about the contrast. So this contrast, can it be given in the pregnancy or not?
This is still under not confirmed 100% that it is safe.
Right.
So we're trying to avoid this during pregnancy.
So until safety established, it has to be avoided.
Yeah. During the pregnancy, of course, as you know that we are doing MRI also for pregnancy itself.
Yeah, exactly.
For placenta previa, grading of placenta previa.
Exactly.
Even for congenital anomaly of the head spine.
Yeah.
Now it is used. Even we are not even it is difficult to use contrast media with pregnancy. We can reach in most difficult case 90% from the diagnosis of the case
Without contrast.
without contrast.
Perfect.
Yeah, we need contrast to reach 100%. But if the patient is pregnant, we can reach to 90%, because most of the lesion, for example, appendicitis.
Right.
Appendicitis.
Exactly,
We are
the
using
pregnancy.
MRI now, replacing CT, of course.
Amazing.
Yes, we can use it without contrast.
So what's preferable?
Without contrast.
For pregnancy, of course, MRI, but without pregnancy, for appendicitis, what's preferable?
CT is a
CT is the gold
CT.
standard,
Yes,
yeah.
yes. Acute. We are now sometimes confronted with acute pain in pregnancy, acute right lumbar pain, right iliac fossa pain. It's not appendix, but maybe stone, ureteric stone. So
Yeah.
CT is not, ultrasound cannot judge.
Yeah.
CT avoided.
Yeah.
MRI, we are using a simple technique called MR urography.
Yeah.
We are using as a
Focused.
we are using we are imaging the fluid of the kidney. If there is
Amazing.
stone impacted in the ureter, it will dilate the ureter
Yeah.
and the renal pelvis and
Yeah.
the calicale system.
Yeah.
So I can take image very similar to eye view of using X-ray.
Amazing. So it's a dedicated one.
Yeah, it is.
It won't
It is
scan
called
other stuff.
MR urography.
MR
Urography.
Amazing.
The same for MR CB, which
Yeah.
imaging of the biliary tree.
Yeah.
Also the same technique. We are imaging the flow. MRI is sensitive, as I said, for certain tissues. Very
Yeah.
sensitive to fluid,
Yeah.
very sensitive to fat, to
Right.
hemorrhage, to fibrous tissue. This is the main tissues. MRI is very sensitive to them.
Perfect. So on the day of MRI, somebody who is receiving contrast, so it can go just before intravenous contrast. But do you use oral contrast also? Patient has to take.
And one technique only, we are using it, what's called MR enterography.
For the gut.
Why? For what? MRI now, again, the gold standard imaging technique for detection of inflammatory bowel disease.
Okay.
Crohn's, ulcerative colitis. Even it is now, طبعا, of course, CT can be used, but CT has ionizing radiation. I cannot use CT routinely in follow-up of cases of Crohn's disease.
Crohn's disease, yeah. So for that,
It can be used the first time first, but follow-up with MRI. I am using special oral contrast, not the same of CT.
Right,
Either mannitol or specific contrast.
right.
The patient takes this oral contrast if there is suspicious of inflammatory bowel disease.
Okay. So how much ml?
Around 1,500 divided.
So then it will take some time for them to take.
It will take it 20 minutes before that.
Yeah, but
It is
1.5 liters.
mannitol. It is
Mannitol.
come, yes. Yeah.
Yeah, but how long they take to finish? They can start in the morning and then they can,
Yes.
2-3 hours, they can finish
No,
1.5
less
liters.
than.
Less than that,
Yes,
yeah.
1 hour maximum.
Perfect. So do you use also per-rectal contrast or no?
Rectal?
Per-rectal contrast.
Yes, sometimes, MRI also is used in assessment of pelvic floor integrity.
Oh, wow.
What is called of pelvic floor descent, which is common also in female.
Right, yeah.
We detect if there is prolapse or not.
Right.
Routinely, we can use what's called dynamic MRI of the pelvis
Right.
to detect the abnormality, if there is cystocele or not, rectal prolapse or not, what is the grade, if there is injury of the pelvic floor of muscle or not, especially in a woman with repeated
After birth.
labor
Birth,
before
delivery,
death.
yeah.
So we ask the patient to lie down in the machine, and we will take image in 3 phases: resting, and straining, and squeezing.
Squeezing.
Yes, and we make some measurement,
Yeah.
the recto-anal angle, and we can detect if there is pelvic floor descent or not. Sometimes doctors, or sometimes if the image is not conclusive, we can inject gel inside the rectum
Right.
and ask the patient to certificate. This is called MR difficography.
Training.
MR difficography.
Okay.
We can use it much more accurate if the findings of dynamic is not conclusive.
Perfect. Amazing.
Yeah.
Now let's move to actual MRI. So patient entering the room, she enters into this machine which she calls tunnel-like machine, and she lies down in there, and she has to pass half an hour inside. Tell me what exactly about this experience.
You know that MRI is a table but inside a tunnel.
Yeah.
In the past, this tunnel it was terrible
Right.
because the bore was very narrow. Now, better,
wider.
now. During the whole time of examination, the patient is in contact with the technician and doctor.
Yeah. Communication is intact.
Through
With the panic call.
Yes, there is panic call, and there is also intercom communication.
Amazing.
And there is also
Technician.
music, hearing music all the time of examination. Any request from the patient, we can detect it on time.
And also there's a technician watching
Of
patient and
course.
monitoring
Patient
throughout.
watching, technician watching the patient, and there is alarming, there is connection, there is
Communication.
so she's not alone.
So it's a monitored situation. It's not like a normal, like you're stuck somewhere and there's no hope.
No.
Nothing like that. So, and people have to be static, not moving. Some people don't find it good that they have to be static.
The good now in new machines, there is shorter scan time.
Yeah.
So the short scan time make the patient more comfortable. Between sequences she can move
Right.
more than before.
So it's more friendlier, more easier.
Yeah.
So once a MRI finishes, a technician notifies the patient that it's finished, and then they can go home. For reporting, it takes time. Of course, it's so much detail, as we learned from you, like how many things, how many aspects, how many images you guys see. So it takes some days, and then patient gets notified that report is ready. So they should arrange an appointment with their primary healthcare provider, the person who requested MRI, to go ahead with the further management. So let's talk about something really being taught, claustrophobia, which 15% of the patients, they do have. So what we have for the claustrophobia, because it's a confined space, patient doesn't have a visual landscape, so their inability to move, that loud noise, and feeling of the loss of control, which I feel is not true, because they have this panic call button and they are with the intercom and they're being watched. So I don't see, but I heard from the patient that they feel inside the machine that there's a loss of control. So how do you manage that claustrophobia?
For patient saying that there is claustrophobia, from closed spaces. First, we will not tell him or tell her, خلاص, okay, we will go to the next step. We will tell the patient, please, we will try first. Because sometimes he believes that he's fearing from closed. But many patients, when we tried for him to lie inside the machine, he told us, I am okay. So first, we will try with the patient first. As I mentioned, the new machine have wider bore than the old one. If the patient insists that still he cannot, there is other alternative, which is very easy. We will make the study with sedation. Not anesthesia. I want to highlight it is not anesthesia.
Anesthesia, it's sedation.
Just sleeping only. It's not anesthesia. It is sedation only.
Yeah.
It will be through the anesthesia doctor during the time of the examination.
And
many patients accept that. Yes.
Open MRI.
Open MRI, it is there since a long time. The issue is, open MRI, as I mentioned before, when the strength of the magnet high, This means good image quality.
Right.
Open MRI using low intensity magnet.
Right.
So for complicated part of the body like pelvis, brain, abdomen, heart,
Quality won't be
the
same.
quality will not be good.
Right. And there are other calming techniques also, like music.
Yeah.
And support person can be there.
Yeah, yeah.
Because
Yes,
it's
of
not
course, of course, of course.
this. What about the VR headsets? Do they interfere with the MRI machine if people want to bring their VR headsets, like to see some videos and yeah?
No, mostly no.
You don't recommend, and they can affect also
Yeah, yeah.
with the image quality. Yeah.
Yeah.
So then let's go to the other thing, which is sound. The sound of MRI, which is like somebody drumming the beat in the marching band. It's like ta ta ta. What about that?
This is also in old machine.
In the
now
old
it's
machine.
this is now they're making softening of
Soft
this.
sounds.
Yeah.
And you also can reduce that
Of
soft
course, of
sound
course.
by earplugs or something.
Yeah.
Yeah, this is also manageable. So there are some myths about the MRI that let's discuss them. MRI exposes you to harmful radiation. So
This is not
ionizing.
Is not correct at all.
Yeah,
It is interaction between the main magnet
yeah,
and our body magnet
right.
through activation
Of the
by
magnet.
radio waves
And
only.
waves, yeah,
No ionizing radiation.
right. So it's completely safe.
Even ultrasound, and the ultrasound is safe also, but ultrasound, I introduce ultrasonic waves
Right,
and the Doppler these ultrasonic waves. In MRI, I'm not introducing anything, just interaction between the main magnet and our body magnets
right.
only.
And we are exposed
Yeah,
already
yeah,
to the
yeah,
magnetic
yeah,
radiation.
yes.
So number 2 myth is MRI is painful and dangerous.
How?
They're not.
No, not.
So they are intimidating actually
No.
because
the patient,
of
the patient only lying
yeah,
for half an hour, more or less.
yeah,
Nothing to do.
nothing
except
to do. It doesn't even hurt. There's no pain. I don't know.
No pain. Even the
No
coil,
pain.
when it's fixed superficially.
Superficially.
Yeah. Even if
It
she
doesn't hurt
if she
at all.
wanted to, if she or he wants some bellow inside under her neck or his neck, it's okay. Yani, we have all the facility to make the patient lying in comfortable way.
Comfortable way.
Yeah.
So they might be intimidating because of the concept, that sound, and they were traditional one. Even those heads decreased, the sound has decreased. Claustrophobia because of the wider bore,
Yeah.
it has become more friendly. And if patient just understand this thing, that a technician is watching them all the time and they have a panic call button and they have intercom, they will understand this is the most like controlled situation. I will tell you, I myself have claustrophobia. So one time I was stuck in a lift and I started remembering and started talking about my kids one by one, that my one is this much years old and another one is this much years old, and everybody was like, doctor, we all have kids.
Yeah.
And it's all, but that was uncontrolled situation. We
Yeah,
didn't know at what time people will come and help us with opening the lift. We were stuck inside the lift.
Yeah.
But MRI is super controlled situation.
of
There's
course.
somebody sitting and watching you constantly.
Sometimes for older children, 9 years, 8 years,
Yeah.
we don't want to give him sedation. Sometimes he accept MRI with his mother inside with him.
Mother inside.
And she can talk to him.
Exactly.
يعني many solutions we have it.
Some MRI also have some TVs or inside
Yeah,
or some
yes,
screens.
yes,
That is
yeah,
also
yeah,
a
yeah.
possibility. And the third myth is magnet. It's a giant magnet and it's very strong. It can pull out all the magnets from your or metals from your body.
No.
It doesn't do that.
What is as I mentioned, there is a checklist
Yeah.
and something the patient have to do before entering the MRI.
Yeah.
Watches should be removed. the any metals inside the body, credit card, all this should should be
Preferably out.
since we are following the instruction.
Yeah.
It is completely safe.
The thing which are removable, like earrings and
All
bangles,
yeah.
but something inside the body doesn't affect much.
Yes.
Yeah. Then the fourth myth is that MRI machine can trap you. And I think this is a reason of claustrophobia. So people cannot be trapped. They can just walk out of the MRI any moment.
At any time.
Anytime.
Since there is a connection
Yeah.
between the technician and the patient all the time.
They can quit the MRI.
Of course.
It's a super controlled
Of course,
situation.
in 1 second,
in 1
you
second.
can
yeah.
release the patient.
Exactly. So fifth myth is MRI is only for the serious conditions.
As I told you before, MRI used for everything.
Exactly.
But
Even to establish the baseline of somebody, if they have
Yeah.
some fibroid or something to define
everything
lesions.
we can MRI can be
yeah.
used.
So it is not for serious conditions.
No,
always, yeah.
not at all.
Number 6 is you cannot have MRI if you have tattoos on your body.
No, it can be used.
It can be done.
Can
It
be
doesn't
used. Yeah,
interact at
of
all.
course.
Yeah. You must fast before every MRI.
Not every MRI, only abdomen and the pelvis. Not fasting.
Not fasting.
Avoid food. Solid food only.
Yeah, they can take
Drinking
liquids.
water, coffee, tea is the same.
This is
Yeah, not fasting. For
Yeah.
abdomen and the pelvis only.
Yeah.
But in emergency situation, for example, we can do.
Yeah.
Yeah, and we cannot wait.
Exactly.
Yeah, and this
When we
this,
need
this is
information,
as
we
our
need.
rule.
Yeah.
But to the selected patient's appointment, this is some of the instruction we give the patient.
Yeah.
Just fasting from solid food only.
When we have the chance, we go for the best outcome. So we can say about the fasting. But sometimes in emergency, we do not have the
patient
choice.
for acute abdomen, acute pelvic hemorrhage. No, will not wait.
Yeah.
for that.
Now, the most important myth, which is because a lot of pregnant ladies around and they might need, and I started my story with the pregnant lady having MRI. So MRIs, they are unsafe during pregnancy.
It is completely safe during the pregnancy.
Yeah, exactly.
Completely safe.
And it can be done. And even you said that,
Early pregnancy, mid
Yeah.
pregnancy, last.
for the pregnancy, even you guys are doing
I even can be used for detection the abnormality in the
baby.
the baby or the placenta,
placenta, yeah.
or any associated
Amazing.
lesions.
Yeah. Then there's a next myth that everyone feels claustrophobia in the MRI.
Not everyone.
15% already.
Less than
that. Even some of
them.
them-
From this 15, we can decrease it to
Lesser.
much less.
Giving them a quick experience of the MRI.
Yeah.
And they feel like, no, it was in their mind.
In my practice, many patients said claustrophobia. I convince them and complete the study.
One of the myths that MRIs are extremely expensive,
Not
which could be quite intimidating to the patient.
not extremely expensive. It is
Machine is expensive.
machine is expensive. It is it's yes expensive, but not extremely. Little bit higher than CT.
Right.
But at the end of the day, most of the patients here in Dubai through the insurance.
Exactly.
So the patient will not pay the whole cost of this study.
Exactly.
And when the clinician document the need for this study, justification,
Exactly.
there's
We
insurance
don't
approval.
do it without indication.
Insurance approval.
Yeah.
Okay.
Even with the cash patient, we don't do it without indication. I mean, there are indications.
yeah.
And patient themselves want to know what's happening.
We are doing, by the way, patient referred from outside, cash,
Yeah.
or patient coming from themselves.
Themselves.
Even for
self-paying.
breast.
Yeah.
Breast also, MRI of breast is another story. Yani,
Right.
Now it is the final
Gold standard.
image of the breast.
Yeah.
So many patients coming from outside, either referred from outside or from themselves to do MRI cash, easy, even with
Yeah.
insurance approval, because they know that the importance of this modality.
Yeah.
It is a final image modality.
Right.
problem solving in all disease in the body
Perfect. Yeah.
without harm of the patient
Yeah.
at the end of the day.
So, Dr. Rady, with the three decades of experience of radiology, do you want to give some message to our audience?
Yes. Radiology is a mirror for the clinician.
Exactly.
The clinician cannot go through to the management of the patient without guidance of radiology,
Exactly.
whatever the imaging modality is. So we are a mirror
Exactly.
for the clinician.
You guys are the wizard behind curtain.
We have the commitment to be a good mirror for you,
Exactly.
good interpreter for the finding for you.
Yeah.
This will help the best management and the best outcome of the patient.
Right.
This is our role.
Amazing.
Yeah.
So patient might not be seeing the person who reported MRI, which guided their management, but people like Dr. Rady are behind and never coming, never knowing, but they are the one active participation in the diagnosis and the management of the patient. Dr. Rady, you brought so much light to our space. She's well for her health, even for the men's health or for whole family health. This all light we want to illustrate by you lighting this candle.
Thank you.
And a little souvenir for bringing so much light, so much information to our audience and to us also.
Thank you.
Thank you.
Thank you.